Hey y'all, it's Sunday and welcome to LW's channel. I am glad to have you here today. We are going to go ahead and jump in and get started. And this is number 11. So I can't really do 11, so I'm putting up 5 and so this is 10 and this is 1. Okay, this is 11. So go get your paper, your pen, and your notebook and let's jump into it, okay? Okay, so the first one we are going to talk about is the proper storage of medication. So when we're thinking about medications, we are thinking about how the medication needs to be taken care of in a sense in order for it to be maintained at its highest potential. So the first one is we're talking about a bottle of Atorvastatin or Atorvastatin. Y'all know I'd be tripping with these little drug names. But Atorvastatin is, and if it's a statin, which I highlighted the word statin or the word stem statin, because I want you to think about Lipitor. Okay. And so if this is a statin and it is used to treat high cholesterol, because that's what Lipitor is used to treat, and that's what statins are used to treat, what is going to be the temperature for the medication to be stored? And remember, atorvastatin is a pill, it's a tablet, okay? So we're thinking about tablets, we're thinking about solid dosage forms. That's important for you to know. Write down that statin is used to treat high cholesterol. And the correct answer for this particular question is going to be letter C. Now, what I did do was I gave you the formula down here at the bottom for how to convert Fahrenheit to Celsius. Please write that down because you're going to need that. Sometimes they give you the formula with the fraction, but I don't like the fractions. I do decimals because it's easier for me, okay? And I do have a video where I have talked about converting fractions, converting degrees and converting Fahrenheit to Celsius and Celsius to Fahrenheit. So please make sure you go and look for that. That is in my repertoire of my YouTube channel. Okay. The next one is drug to dietary supplement interaction. So anytime we think about an interaction, we're thinking about how two things coexist together. How does it work together? Does it work together or does it do better apart? Okay. Also, if you have not subscribed to this channel, baby, what you waiting on? Subscribe to this channel because you are coming every Sunday. You hear every Sunday, you hear every week getting the information. Okay. We got the deets for you. Drug to dietary supplement interaction. Iron interacts with levothyroxine in a negative way. So that means that we don't want the patient taking iron with levothyroxine because it does interact negatively. Please write this down. Drug to dietary supplements and or how drugs interact with each other is something you will see on your exam, okay? That is something that you will see that in the pharmacy. So if a patient is taking iron and they're also taking levothyroxine, you want to alert the pharmacist because that is a negative interaction. If iron decreases the medication, then we don't really want the patient to use iron, right? So, and remember too, that sometimes when they're coming in the pharmacy, people are seeing different doctors for different reasons. So one doctor could be the cardiologist, then they could be seeing a neurologist, and they could be seeing an endocrinologist, and they could be seeing their PCP. And so if they're seeing 4 different doctors, you have 4 different doctors who are writing 4 different medications. These doctors are not connecting with each other in any way, so they don't know what the patient is already taking. And it's possible that they could be writing a script that interacts with another script in a negative way. That's why we're there in the pharmacy, okay? It's to make sure that these interactions are positive and not negative. This one is also proper storage of medication because this is also a part of that 40% of the drugs, okay? 40% of what you will be tested over and just what you need to know in the pharmacy, period. It says a vial of Humulin N. Whenever you think about insulin, think about diabetes. I want you to think about diabetes, okay? Think about diabetes because diabetes is going to be the treatment or it's going to be what insulin is used to treat, okay? And when we're thinking about how long something should be stored, it says, how long should this vial be stored at room temperature? So we're basically thinking about how long will this last? I want you to remember that insulin is a maintenance drug. It is used to maintain the insulin level in the body. So most maintenance drugs are going to be good for 28 days because most months have either 28 to 31 days, right? And so we know we have months that have 30 days, some have 31, some have 28, and some have 29. And we're talking about February, obviously. So 28 days is going to be the number because I think 28 days is the shortest number of days that we can have in a month. And so when we're thinking about how long medications can last, we're thinking about 28 days, and they're doing that because that is the shortest day of a month. And we want to make sure that if they're getting prescribed a medication where there's only 28 days, that the medication will last 28 days. Now, if it's 31 days in a month, obviously this medication won't make it to 31, but it will make it to 28. So your answer is C. Write that down. Another thing I want you to know about insulin is it normally comes in 100 units. Write that down. When you see a problem on your exam or in your studies, you will not see, sometimes you won't see that the insulin is in 100 units, but it is. And that's something that you have to remember. The author of the assignment or your studies is expecting for you to remember there are 100 units per ml. So if there is 10 mLs in this bottle and there's 100 unit per ml, ultimately there is 1,000 units in this bottle. Okay? So make sure you remember that. Let's talk about this drug series we've been on. Okay. Look, honey, y'all been rocking. I can't even believe we made it this far, but it's 11. We on series 11. We got one more to go. So if you are just now catching in and zooming into this information, you have missed quite a few. Okay. This is number 11, but please start with number 1 so that way you can get all of the information. We have covered the top 200 drugs. We got one more video left. I am proud of us. Y'all done stuck with it. Look, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, baby, and we here, okay? So please make sure that you do start from the beginning, get to the end, and we have one more. Tell your friend, tell your cousin, tell your auntie, tell your uncle that at LW we're helping you to retain that pharmacology information, okay? Make sure you subscribe to the channel if you have not done so, because we want to get the information out into the algorithm. It will help other people to see it, okay? Physical incompatibility. So when I think about incompatibility, I automatically think about relationships. And one of the ways that you can tell if a relationship is compatible is by the physicality of the person or the people in the relationship. And a lot of times when you get, your friend get with somebody and you like, okay, and you just watch and you like, okay, let me see if this person gonna be good for my friend. Let me see if this person is my friend's person. Let me see who they are. So you looking and you watching and you like, okay, my friend's starting to act in ways that my friend never really acted before. So she kind of changing. Okay. Then you start looking at the relationship and you like, okay, they not really treating my friend the way that they need to be treated. And I'm just wondering if they're compatible because my friend's starting to change and I'm noticing that the person she's talking to, they are, aggressive, and my friend is starting to be really sad and insecure at times. And I'm just wondering if they're compatible. And one of the ways that you can see very quickly if someone is compatible is by looking at the physical appearance of that person or the relationship. So when you think about physical incompatibility of a drug, I want you to look at I want you to think about the physical appearance of a relationship, because ultimately that's what this is. We're talking about a relationship. Well, I'm giving you 2 different images here. One is a soluble in liquid, and then one is an insoluble liquid. The soluble liquid mixes very well. There's no problems. It goes through. Everything is fine. The insoluble liquid, it separates. So when you think about something that is incompatible, you're thinking about something that separates. Your friend wasn't aggressive, but now your friend is talking to somebody who's aggressive, and that person is making them feel insecure and is making them feel sad and making them feel not good enough. And so you're like, where is that coming from? Because now you are different. You've separated from who you used to be, and now you're turning into someone who doesn't really look how I'm used to you looking, or you behaving the way that you used to behave. So when you think about physical incompatibilities, I want you to think about the difference or the distinct thing that separates that medication from another medication, or that makes it insoluble. So if it's insoluble, that means that we can't mix it. It doesn't work. It's too big. It's too small. It won't fit. That what Beyonce say, it's too big. It's too small. It won't fit. Baby, it just don't work. Okay. That's what I want you to think. I think a lot of times y'all are trying to make these things where you're trying to think so much science that you're not thinking common sense. Use your common sense. When you start thinking about, I use relationships for a lot of things. I like to use relationship and food, because everybody like food, and a lot of people, everybody wants some sort of love from somebody, whether it's a dog, a cat, a man, a woman, a she, whoever it is, a them, a they, you, and everyone seeks love, right? So when I think about certain things, I'm like, okay, well, how does this terminology align with what I already know? So a lot of times you may not necessarily walk around saying physical incompatibility. That may not be something that you say, but you do know what the word physical is. You know that physical is going to be the outer appearance. Physical, physical education, PE, that means you're using your body. And then incompatibility, when I think about incompatibility, I automatically think about, well, are these two people compatible? How long is this relationship gonna last? I want y'all to start putting 2 and 2 together. Context clues. I know when I was in school, they taught me about context clues, and that helps to increase your common sense when you are getting and trying to figure out these questions, okay? So the answer is going to be B, insolubility of the drug in the vehicle, okay? Now we have indications of medications. So the indication of this medication is to treat epilepsy. And we know epilepsy is seizures, right? So letter C is used to treat seizures. And I put that down. And that's just one of those things you can remember, okay? That's not anything too crazy. Proper storage of medication. So when we're thinking about the proper storage of medications, we're thinking about how to protect it from light, okay? Particularly, we're thinking about vaccines. And the answer is letter D, Zostavax, okay? And Zostavax is used to treat shingles. And do y'all be seeing that commercial when they say shingles doesn't care? And then they say something else and they be like, shingles doesn't care. Yes, baby, they talking about this little vaccine right here. They want them to go get that vaccine. I think if they're over the age of 50, shingles is, obviously something that can happen to you. And I think if you've had chicken pox, some of y'all may not even know what chicken pox is, but I had chicken pox when I was younger. And it left a scar in my eyebrow. You can't see it right now, but if you scratch, it will leave a scar. And baby, look, I know I was scratching. And my mama had put calamine lotion all over me, and I was getting these oatmeal baths, and baby, I was just itching. The kids don't get it anymore. Baby, these kids 2023 so blessed, but I do know I did, okay? So Zostavax. Beyond use date. So I want to talk about the bud for a second. Beyond use date. And when we're talking about water containing topicals or dermal formulations, we're talking about topical things that can go on the skin. And that word derma, DERMA, is skin. Topical is going to be on top of the skin, top skin, right? Look, I told you we're gonna pass. But when you think about a beyond use date, it is different from, it is not the expiration date, right? It is the date. The expiration date is given by the manufacturer. The beyond use date is given by the compounder. Okay. So this is not going to necessarily be a tube that you can buy from Walgreens, and when you buy it, you change the date. This is going to be when it has been compounded, because at pharmacies, people may need a type of prescription that they needed to be compounded, and we're going to put a beyond use date on it. That means do not use beyond this date. Okay. So again, let's talk about food. When you cook your food, the expiration date that the store may have given it was 30 days. But when you make your food, you may not say that this food is good for 30 days. You may put a beyond use date of 5 days. You may say after the 5th day, do not eat this anymore, right? So the store gave it a 30-day expiration date, but because you're the compounder, you're the cook, you said no more than 5 days, right? So when you're thinking about that, I want you to think about the compounder gives the beyond use date, the manufacturer assigns the expiration date. Write that down. Letter D is going to be your answer. Letter D, okay? The next one says drug instability. So what is the sign that the drug has gone bad? I know one of the signs of milk is that the milk begins to smell sour. It begins to kind of chunk up, and you can just look and tell that that milk isn't good anymore. Okay, so when you're looking at these ointments, you're going to see if there's grittiness in that ointment is no longer good, because you and I both know that ointments are supposed to be smooth and thick. Okay, and they should not be gritty. So if it's gritty, like little crumbs, we don't want to use that ointment. That means that that thing has gone bad. Okay, so grittiness is a sign of drug instability inside of ointments. The beyond use date, here we are again. The maximum beyond use date that can be assigned to multiple dose vial. When you hear that word multiple dose vial, I want you to think about, what does the word multiple mean? That means it can be used more than once. Dose, that's how much is being given at a time. Vial is the container. Put those things together. People hear multiple dose vial and they get nervous because it's not a part of their everyday vocabulary. And it's like, what is that? Multiple dose vial just means that we can get more than one sip out of this container. This is a multiple dose vial in a sense. My dose can be one sip. I can get multiple sips, and the bottle is the vial because it is what holds it. Okay. But look, let's make it easy. Let's make it easy. Okay. They're not paying us to make this thing hard. Some of us are used to working hard, and we are bringing that same energy into this. And that's why it's not working for you, because you're working too hard. And then that's why too, when you always look at other people and you wonder why those people have things that they have and you don't have those things, it's because you've made life a little harder for yourself than they have. I understand, operating in excellence and wanting to be the very best, and there's nothing wrong with that. But there's also a level of peace that comes along with working and doing things the correct way. There is a balance. There is a gratification in knowing that you gave it your best. It didn't mean that you have to work hard. Giving your best doesn't mean that you have to work hard. Sometimes giving your best is just showing up. Okay, so we're not going to keep working hard. Please keep that energy somewhere else. Do not bring that in here with us. We don't want that energy. Okay, friend? Okay, friend. The answer for this one is letter D, 28 days. It cannot be assigned longer than 28 days, okay? The next one is USP 797 sterile. When we think about 797, I want you to know that 797 is sterile, 795 is non-sterile, 800 is hazardous. Write that down. 800 is going to be chemotherapy. 797 is going to be like your IV bags. It's going to be your intravenous medications. And then 795 can be your compounding ointments or, different type of topical things that you're using. So according to 797, a controlled temperature in the area should be monitored at least once daily. And we're talking about sterile compounding rooms. Where that sterile compounding is taking place, we need to make sure that that temperature is monitored and that it meets the 797 standards, and we should be checking it once a day, okay? Proper storage of medications. An open vial of insulin is stable at a room temperature for how long? Remember, we talked about this. If it is a vial that has been open and it is going to treat the patient, this one can be used for how long? For how many days? 42 days. 42 days. USP 800 hazardous drugs. USP 800 states that hazardous drugs must be stored externally with a pressure room of at least 112 air changes per hour. That means that thing is keeping that room clean. And it needs to be externally ventilated because we don't want to inhale hazardous drugs and/or hazardous substance when we are compounding. We want to push it out. And we want that air to be changing, and we need that negative pressure in the room to make sure that nobody is inhaling anything negative, okay? Like I told you, keep that negativity where it's at. Don't bring it over here, okay? That's ultimately what they're saying, so your answer is letter A. And I do want to thank you again today for joining us. This is our 11th series. Part 11 to our series, and so part 12 will be next week. It will conclude our series. We have been basically on a 12-week journey, honey. It has taken us almost 12 weeks to get these top 200 drugs completed, but once they are done, you will know them, and you will know them fully, and you will be confident, and you will be encouraged that you will pass your board exam. Thank you for showing up, friend, and thank you for being a part of this day with me. I am super excited and very happy to know that we're working together and that you're putting your best foot forward. If you have not subscribed, please make sure you subscribe to the channel. Please also make sure that you are sharing this information so it gets out into the algorithm so other people across the world and all around the country can see this, okay? And then, friend, as you study tonight or today or tomorrow, be gracious to yourself, okay? Make sure that you're creating that balance and make sure that you are celebrating your small wins. It doesn't mean that you have to conquer the entire 125 question test that y'all be doing. If you get 50 right, that's better than 0, okay, friend? Continue to be you. I love you. I am proud of you, and I can't wait to see you next week. That is going to conclude our 12-week series. Thank you so much for watching, and I will see you another time in the same place next week. Bye.